Dr. Donald Heck with Cone Health Neurosurgery at Greensboro, talking about how to prevent stroke. So let's start here. Talk more about steps we all need to be taking to help lower our risk for stroke.
Yeah, I would say that the first step is to really have a conversation with your primary care healthcare provider. This is really in their wheelhouse in terms of how to lower your risk of having a stroke or a heart attack. And if you go in there and say, I really want to lower my risk of having a stroke or a heart attack, I want to have a normal blood pressure, I want to have a normal cholesterol. They're gonna love that. Every doctor loves a motivated patient, and so I think it starts with a conversation with your primary care healthcare provider about lowering your risk factors for stroke and heart attack, and that's a great place to start.
Absolutely. And we spoke about signs and symptoms of a stroke like facial drooping and others. If we notice any of these signs, what do we do?
Yeah, so the key thing to remember is that it's an emergency. So when you're having a stroke, what's actually happening is a part of your brain isn't receiving enough blood flow, it's not receiving enough oxygen to function normally. And if that goes on for long enough, that part of the brain is permanently damaged and won't recover. So when we notice these signs of having a stroke, we have to realize it's an emergency situation, that there are effective treatments, but they have to be administered quickly. So it's a 911 call. It's not time to wait around and see if it gets better. It's not time to take a nap and see if you feel better when you wake up. It's an emergency, and that's really what we need to remember, that it's a 911 call when we are having stroke symptoms ourselves or when we witness somebody that's having stroke symptoms.
And I have to ask, Doc, what are the dangers of waiting?
Yeah, so the effective treatments we have are only effective if they're administered quickly. So if we wait too long and the brain is without blood flow and oxygen for too long, the damage can be permanent, and then there may not be things that we can do to help. So the danger in waiting is that we may miss the opportunity to save brain tissue and in that way limit the disability that a person might experience after having a stroke. So we don't want to wait around because we want to save as much brain as we can, and that's where the time is brain saying comes from, is that the sooner we get to things, the more benefit they're going to be to the treatments we have to offer.
That's definitely a key point. Let me ask you this. What's a common misconception about strokes that you want to set straight?
Yeah, probably the most common misconception is that it won't happen to me because I'm too young, I'm too healthy. The fact is that, as we talked about earlier, they're definitely more common as people get older, but when a person is having those symptoms, even if they're young, healthy, it could be a stroke. I mean, there are a lot of things that affect young people, and just as physicians sometimes have trouble making that diagnosis, sometimes the public also may not think about stroke because somebody is otherwise young and healthy. So when we see those symptoms, it's an emergency. We want to get to the emergency room where physicians are there at a stroke center to sort out what's really happening with the patient, and if it is in fact a stroke, to administer emergency treatments in a timely fashion.
All right. Well, thank you so much for having this important conversation. Again, if you may have missed this entire conversation, you can find it on our website, WFMYnews2.com.